We're watching the video of everyone sneezing and coughing and rubbing their eyes. Oh, we are talking about tips to fight the flu. Zach Thompson from Dallas County Health and Human Services joins us now live to talk about it. Good morning, Zach.
Good morning. It's flu season.
Yes, flu season. And is it our imaginations, or is this flu season a little bit earlier and a little bit worse than years past?
Well, flu is unpredictable. This is the time that we'll normally see flu cases. We're in an uptick in terms of flu cases in Dallas County. But the key point is to make sure that if parents see that their children are sick, they keep them at home. That's one of the challenges, is that we have a lot of parents dropping their kids off who are sick, and that's contributing to the flu cases and a possible flu outbreak. Right now, we've not had any flu-related deaths in adults, and of course, we haven't had any in pediatric deaths. The concern is that we see these upticks in flu cases. It could lead to possible deaths. So in previous years, we've seen 2 pediatric deaths, none this year, and of course we have averaged 19 or more adult deaths in Dallas County. So the key point is get your flu shot. It's not too late. Make sure you wash your hands frequently. If you're sick, don't try to go to work sick and spread the flu virus to your coworkers. And of course, always check your children daily.
And here's the question too, Zach. I think where people are remiss a little bit is they think they're okay. They show up at work. They realize, maybe I'm not, but they figure they should stick it out. Is that a situation where you should go immediately to a clinic or to your doctor and get a flu test?
Yeah, check in with your doctor. Make sure if you're having a fever that you don't go to work. Definitely check in with your primary physician. That's going to be the key point. Oftentimes people wait to the last minute. They don't get the flu vaccine. They get the flu symptoms, and then they still want to go to work. Take off. Don't give the flu virus to your coworkers.
How many days are we talking here? So say you start to feel better, you feel like, okay, I've got a big project, I've got to get back to work. Is there a certain amount of days where you are contagious with the flu?
Well, you shouldn't have a fever, so that's one sign. So if you still have a fever, you should not be going back to work. Your children should not be going back to school. I want to commend the ISDs who shut down during this period, because it gives an opportunity to clean the building and make sure that as the children come back, it gives a chance to make sure that they're ready to start school and be effective for the rest of the school year until we go into the Christmas season. We're coming off a Thanksgiving holiday. People have been traveling. Flu cases normally peak in January and February. We could have an early peak, but the key point is make sure that you take time and wash your hands, get the flu vaccine, and stay at home.
Right, so he's referencing Sunnyvale ISD, which closed down for a couple of days so that they can go through and disinfect everything and make sure everybody is staying home and getting well. Now let's talk about, with regard to the flu vaccine, how often we should be doing this. Say someone got a vaccine earlier in the year, maybe end of the season last year. Should they still get one now, or how long do you wait in between?
Well, it depends on when they receive the flu shot, the vaccine. Make sure they check with their primary physician for the timeline. But most people should be getting it around March or April, so it's still effective. If they got it last year, definitely check with your primary physician. You should be getting a flu shot every year.
So once a year, once every year?
Once a year, that's correct.
Zach Thompson from Dallas County Health and...
The children need their flu vaccine.
Go ahead. Say that one more time.
No, it's make sure that this is a family activity and that the children should be getting their flu vaccines as well. Thank you.
Zach, we appreciate the time. I know that you're busy, and so we appreciate you coming on with us this morning.
Thank you.